The broadcast is now starting. All attendees are in listen-only mode.
Hi everybody, I'm Dr. Lisbeth Roy and I'm here with my friends Dr. Joe Banno, Dr. Emilia Ripoll. We have Jill Swartz and also Chris Berman from BioProtein Technology, and thanks Chris for hosting this webinar. We want to have just an honest conversation with you, our colleagues, about adding platelet-rich plasma to your practice, because it's been a real practice changer for me. I've been using platelet-rich plasma for about 6 years, and Dr. Banno and Dr. Ripoll also have lots of experience. We're all in different parts of the country, but we collaborate and work together quite closely, in fact. So let's talk a little bit about the market. The market is very exciting, actually, and there's some new data that shows that PRP is going to go from a $160 million industry to $452 million in 2024. And so that's very exciting for all of us entrepreneurs, of course. But what's most exciting, because we are physicians first, is that this technology works incredibly well for lots of different modalities and different challenges. And so we can talk a bit about that. But I mean, what's better than something that works? It's a regenerative therapy, so it's from the patient to the patient, and it's growing and is quite profitable. So that's sort of the perfect storm. And as physicians, we have a rough time in business quite frequently. In 2011, more physicians filed bankruptcy than any other time in history. And so, insurance reimbursements are changing. It's a very difficult climate out there. I'm very happy to be doing PRP now for a while because it's saved my business, to be perfectly honest with you. There are a lot of Americans who are looking for platelet-rich plasma. They're certainly looking for anti-aging types of interventions, joint pain, hair regrowth. They're looking at dietary supplementation. So the whole functional and regenerative approach is very hot right now, as it should be. It's a wonderful way of caring for patients and a great way for the patient to get what they need. The public spends $70 billion annually on medicines for age-related diseases, so they're certainly willing to spend money, and they're looking for results and different modalities. So for these patients seeking functional and regenerative approaches, we have the birth of platelet-rich plasma in the marketplace. And really we're helping as leaders of this paradigm shift from a disease management approach to a more prevention and wellness approach. And then certainly PRP is intervening and is a remarkable medical intervention when there is a problem. So it's not just a prevention type of a problem, it's a true intervention. And what we are trying to do as a group is to help you with this opportunity and to share with you our experience and our vision and the ways in which we grow our practices. What works for me may not work for you. What Dr. Ripoll does may really sing to you, and Dr. Banno has certainly been very successful. So the variety of us, we use PRP for different modalities. I use it for female as well as male sexual dysfunction, for urinary incontinence, certainly joint pain and muscle pain, for aesthetics, to regrow hair. I mean, for dry eye, I just injected eyelids and we're getting some regenerative benefits there. And so, there really isn't anywhere that I wouldn't put platelet-rich plasma. There are places that we're quite successful putting platelet-rich plasma, and we're certainly willing to talk to you a little bit about that. But it's very exciting because PRP is entering to all kinds of different little niches, and people are embracing this in a big way. And the more platelet-rich plasma is known as an effective, reasonable intervention, the better it is for all of us. So we offer these procedures and we tweak the protocols, if you will, as a collaborative effort. We all want to make these procedures as good as possible, as comfortable for the patient, as effective. And so it takes a team to do that, and so we really work as a team to try to help improve these things. There's literally no side effects. I have not had any complications. Very high retention rate because, again, platelet-rich plasma is popular, and if I inject a knee for the patient now and it works incredibly well, then they're thinking, wow, maybe I need this for my sexual dysfunction, or maybe I need this for my hair. Certainly it's going to increase your practice revenue and profit, more than just revenue. These are quite profitable. We'll go through some of the numbers very, very shortly. And then, of course, we collaborate as a group. We use the best equipment. We use the current science to help us understand the best approaches, because we want to develop that reputation as a real specialist in this field. There's a lot of people doing platelet-rich plasma, not necessarily following any sort of logic with the equipment that they're using or the basic science. So with any new procedure or new modality, there's always a growing up period, and I think that we're in that growing up period, and you certainly entering now. You're not late to the game by any means. You are still very, very early to the game. So in 2012, I started using platelet-rich plasma for aesthetics, really. I didn't add the sexual medicine until 2011, and that was after I was doing aesthetics for several years. Adding platelet-rich plasma changed the game for me. It was pretty awesome. My patients that I'd been using Botox and fillers in, who had been quite happy, were now even happier because of the benefit that the PRP lended itself to with rejuvenating the skin. So I think about Botox relaxes the muscles, the filler creates the shape, this PRP rejuvenates the skin and creates a real youthful glow, if you will. So my patients stood up and took notice, and they were requesting rather, that I use PRP. And so after watching what was happening with the skin for about a year, I thought, this could work from a sexual medicine perspective. And so I got some training, and off to the races we were, because it really does work very, very well. So I added the hair regrowth procedure, and none of these procedures are going to be a magic wand. I just want to say that really early on. Platelet-rich plasma is a tool. We're all professionals. We all have lots of tools in our toolbox. And so, to think that we can just solve every problem with platelet-rich plasma is not true. However, we can solve a lot of problems, and we can certainly use PRP as a very effective tool. And so, I think it's important just to point out, again, this is just an honest conversation. We'll certainly share our ups and our downs with you should you wish to ask any questions. So in 2011, very early on, I started training physicians to do these procedures, and that's been wonderful because I've met hundreds of doctors, and we all continue, many of us continue to communicate and help each other through some of this. I did the stem cell fellowship through the A4M. I did some other stem cell training through I think it was RegenaStem. They've changed their name a few times. And I haven't gone there. I really haven't embraced the stem cell part of this normal, what would seem a normal progression yet. It's something that is very labor intensive. There's not a lot of data that supports it yet, so I'm a little slow to the game. With PRP, it's a very simple blood draw. It's very simple for the patient, and I'm getting some nice results. So certainly not crossing stem cell off the list by any means, but I'm not there yet, and I've been in this for quite a while. In 2015, we co-published a very small study for it was actually for female sexual dysfunction. It wasn't for ED, and that was with Dr. Runnels. And then Dr. Banno presented a paper in 2016, this 2017 already, in 2016 at the SMSNA, and that was looking at erectile dysfunction, and I'm sure he'll be happy to tell you a little bit about that. I published a book that we really haven't even fully introduced yet, and it's called Regenerating Sexual Potential, and it really is all about all of the different modalities that are available to men and women, and including platelet-rich plasma. And it's a good book in that regard, that it helps to show you the place that platelet-rich plasma really has in the sexual medicine world. And then in 2015, I really co-founded PRP network, and that's primarily a training, marketing, and research company where we are working collaboratively together for the best outcome. And that's where I met Dr. Banno and Dr. Ripoll together and have been really teaching each other. I've learned so much from the physicians that I've taught and the physicians that continue to teach me every day. So a couple of things that I do in my practice that have helped me become successful financially in this particular space is that I host regular educational talks, because that's important. People want to hear from us. They want to hear how it is that we approach their problems and what platelet-rich plasma is all about. There is a healthy skepticism out there, which I think is appropriate. That's my best patient, is the one who comes for education, and then it makes sense to them. Once I give them some of the basic science, it makes perfect sense to them. My waiting room loop, which Jill Swartz put together, and that is available to any of the StudioPRP physicians, has been the best salesperson. Because although my patients have a very small specialty concierge type practice, my patients don't sit in the waiting room very long, but that loop is running and it's beautifully done, and they really ask a lot of questions about what it is that I do. Even patients that I've been seeing for years, they don't know all of the things that I do here, and so the waiting room loops helped a lot. I do make videos all the time. Some of you may have seen some of my videos. I just go on YouTube. There's nothing fancy. I hit record and I just tell my prospective people what it is that I want to say. And that has been the most effective for me. I don't need a videographer. In fact, I think the grassroots videos without a videographer, without any real production, are the most effective. I have some out there that have been viewed, 50, 60, 70,000 times, and people were coming from all over the world for these procedures to my practice. Now that we have hundreds of physicians who are treating patients around the country, and we're trying to promote all of your practices, then it's a lot better for the patient. Certainly, flying from California to Florida, they have certainly good physicians in their area. So video marketing is a great way for you to talk to your patients. Patient testimonials. I love it when patients are excited about their results, and so we'll video them, or we'll just ask them to write a little something, and they're always willing to do that, even if they're not willing to be on video or they don't feel comfortable. So those are really important. And then staff training. We talk all the time about platelet-rich plasma here. We share the patient's successes. Patients come in really excited about the benefits, and your staff is coming to work every day for that. I'm sure of it. It's the only reason why you'd be a doctor. It's the only reason why you'd work in a doctor's office, is to see the patient's successes. And so the staff really participates in that. And then referral marketing. So I actually have a rewards program here. I reward patients for referring people to me, and they love to refer people to me. They not just for the rewards. I mean, they love to share their good doctor, if you will. Someone has helped them, they share with their friends and their family. We sell packages at my practice, so if I think that a vampire facial, or rather a microneedling with the PRP and the Rejuvaderm or the dermatropin is going to be helpful, then I will sell a package of 3, because that's what I think it's going to take. If I feel like a guy with severe erectile dysfunction may need a couple of P shots, then I'll sell a package of 2. And in my practice, I include the peripheral devices. So for an O shot, for instance, for female sexual dysfunction or urinary incontinence, I actually include the Apex M, or the intensity, in that procedure, because in the price of the procedure, and I don't make it optional, because I think it's part of the success. If I need to prescribe a hormone cream, for instance, I will prescribe 60 days of a hormone cream, because I'm taking a look at my individual patient and I'm applying the tools in an artful way to get the best result. This isn't an academic exploration where I say, well, what is the O-shot doing here versus what is the Apex M versus what is the BHRT. I just want my patient to have success, and so I really load it in their favor. When I think that a vacuum erection device is necessary if we're trying to rehabilitate erectile function, which I believe it is 100% of the time, then I'm going to include it in the price of my P-shot. So I think you get the You get the gist. We're going for the wow. If we get the great results, our businesses thrive, and that's where, you know, we work together. But here's Dr. Banno. Feel free to tell us about your experience, Dr. Banno.
So I've been in this practice of sexual dysfunction for a long time. In 1992, I started the Sexual Health and Treatment Center of Illinois with a psychologist and a psychiatrist, and we formed a great bond. And over the years, in my little area of Central Illinois, I'm erectile dysfunction. I have patients and physicians, even competing physicians, send me their patients. In 1996, we developed a mobile surgery center that was has been used worldwide now. And my ambulatory surgery center that I have on campus also allows me to do minimal invasive penile implant procedures, which are around 15 to 20 minutes. So when I met Dr. Roy, I had been reading about platelet-rich plasma and stem cells, and I thought this fit very well into my practice. And so, you know, I look at it that sexual dysfunction, especially erectile dysfunction, is my special expertise, and I can take them from all the way to, you know, talking to patients, to pills, to injections, to vacuum devices, to platelet-rich plasma, and if need be, penile implants. So I try to do it all, and since I've been dealing with urinary incontinence for over 30 years, the O-shot has been tremendous for me. I think I'm looking at 90% success rate with the overall result of the O-shot. And so for mild urinary incontinence, overactive bladder, people who don't want to be on any of the pills and medications that kind of make their mouth dry or they have constipation, a great alternative. I had 3 women come in to see me today and follow up, and they ranged from age from 32 to 62, and they were all very happy. 2 of them had incontinence, and they were cured of their incontinence, and one was a strictly sexual problem, inability to reach an orgasm for years, and now she's having an orgasm, and she's very happy. I have a new physician assistant who very early, I think 2 days after we started, I sent him to be under Dr. Roy's tutelage, and he's now doing facials and hair restoration for me using platelet-rich plasma, and I think he's very excited to do that. Unlike Dr. Roy, I just focus for myself with the P-shot and platelet-rich plasma for women for sexual dysfunction and incontinence. And I let my physician assistant perform the facials and the hair regrowth. As Dr. Roy mentioned, the study on platelet-rich plasma for erectile dysfunction, I did present at the Sexual Medicine Society, and it was very interesting and really very well received. I think since my specialty is urology, you know, the organization, you know, wanted to see hard data, and unfortunately, because PRP is a natural substance, our own blood, it's very hard to get funds, and so we did this on our own, and I've approached several corporations for funding for a prospective randomized study, and we hope to have that this year. Our PRP lectures once a month. I do radio ads, print media. I'm on TV for short commercials, and Thursdays is my day to do the PRP procedures and for the follow-ups and for prospective patients. The way I work up a patient for erectile dysfunction is a history of physical examination, laboratory data including testosterone and PSA. I will tell you again, I probably 3 times a month I see a patient for erectile dysfunction and they have prostate cancer. And it's not just enough just to obtain a PSA, but a digital rectal examination is complementary and necessary. And then I also schedule the patient for a penile duplex ultrasound with vasoactive injection. Unlike many physicians, I do not use Trimix. I only use a Fosfidil because that's FDA approved, and I just think life's too short. I don't want to deal with it. And so there, when I get the results, they can see the any curvature from any plaque formation or microcalcifications. We can see if there's arterial insufficiency or venous insufficiency. So now when I schedule a patient for platelet-rich plasma for erectile dysfunction, if they have the procedure, then 12 weeks later I will schedule them for a follow-up duplex ultrasound. And what I'm actually finding is that these patients are increasing their blood flow in the arteries, and their venous leak is lessening. And the patients are thrilled at looking at this. So, you know, I will encourage the audience out there to consider using a penile duplex ultrasound.
Yeah, and Joe, so I don't actually use the duplex ultrasound, and I do think that it's an exciting thing that I would like to add to my practice, because I do think it's very powerful when you can show people that objective data for sure. Most people don't actually have the benefit, and it is a true benefit of the duplex ultrasound in that data. But it is fun that you do, and you're able to produce. You know, I wanted to mention also that Peyronie's disease, a lot of people don't realize that we're getting such great results treating Peyronie's with PRP. Can you speak to that a bit, Joe?
Another patient who came to see me today had his procedure on January 5th, and already he noticed that his penis has less of a curve. Sometimes when I see a bad curvature, and I usually have the patient take a picture and show it to me, or we'll see it when we perform the ultrasound, it may take more than one procedure. I've done as many as 4 procedures, and the patients are happy. They realize that the only alternative is to use a medication called Xiaflex, which really costs about $40,000. So the patient, you know, copay comes in, and it has a great deal of side effects. So I'm not a big proponent of Xiaflex. I think with Dr. Paul Perito and myself, and I think Dr. Roy, and I haven't talked to Emmy about this, but you know, our results are better than Xiaflex used platelet-rich plasma.
Yeah, I think it's very exciting actually to think about platelet-rich plasma and Peyronie's, and we have a huge opportunity there that we really even haven't tapped into. I have not reached out to the Peyronie's patients, and I'm going to, because the results are pretty consistent. And you're right, they just don't have any very good options, and this is an excellent option. But thank you very much.
And Dr. Joe, could you also speak to the fact that it's one thing is a little bit different in your practice with PRP is that you also take insurance. So I think it's interesting for the attendees who do take insurance, how you've sort of incorporated this cash-based modality into your practice. You're doing it one day a week, or can you tell us about that?
So for the non-Medicare patients, my fee is $2,000 for PRP of the penis. We bill their insurance for the vacuum pump, and we write a prescription for daily Cialis. For the patients who carry nitroglycerin, then I use Edox that I get through StudioPRP. For the Medicare patients, the fee is the same. Plus, there's another, I charge them really what I pay for the vacuum pump, and then they buy their own Cialis. For the Apex, it's just built into the price. Everybody pays $1,650.
Okay, so basically what you're saying is that you've been able to incorporate this pretty successfully into your practice, even though much of your practice is insurance. That's a big challenge.
Yeah, it is a big challenge, and I wish my practice was like your practice.
Yeah, I've got the best practice, that's for sure. All right, well, thank you very much. And Dr. Ripoll, are you on the line?
Yeah, I'm here. So thank you for inviting me, and I have to agree with everything that you both have said. Primarily, of course, because Dr. Banno and I are both urologists. We've been using PRP in similar ways, and I've had, like he said, he's not exaggerating when he's telling you about the excellent results that he's having. I've had the same experience, you know, and it brings me great comfort, because you always get suspicious if there's only one person who gets good results and nobody else in the group does. But, you know, we all do, and it's comforting to me. You know, I started on this journey of trying to use alternative ways of helping women with incontinence and children with ureteral reflux years ago. In 1990, when I was a resident at Baylor, we started experimenting with collagen. And we started, you know, trying to do it in the lab, and we played around with cross-linking, and then we did it from pigs and all kinds of animals. And so I always had a little bit of, you know, nervousness about using something that was not made from your own body. And you never knew about the sources. And also the other thing that was difficult was trying to find the right cross-linking, because even though it was a great bulking agent, it did nothing for rejuvenating the tissue. It did nothing in providing new blood vessels and in creating a setup that would have future, meaning that things would get better with time, instead of the collagens, which, you know, if we were lucky, if it didn't get broken down in about 3 months. So realistically, what I love about PRP, and I think Dr. Roy mentioned it, is that we know in our hearts that we're doing something that there's no harm. I have never seen a complication, maybe a little bruise here and there, but I've never seen a complication. The other beauty is we know we're not putting anything artificial. So that to me is very comforting. Primarily when for years, you know, treating women who were beyond the usual ways of treating urinary incontinence and had to undergo surgery, and using those meshes, which now we know where, you know, down the road can cause a lot of damage. And so putting something or doing a technique that you know has great results and that has no complications is just really helped me sleep better at night. The other thing that I really liked, and you know, kind of when I went and was lucky enough to meet Dr. Roy and Dr. Nichols and other people like that, Dr. Reynolds, and then so fortunate to find Dr. Banno as well. And, you know, sharing how can we take these to the next level? You know, it's great. We know that it helps with this, that, and the other. And it always amazes me, and I just love Dr. Roy, because if she can reach it with a needle, you can bet your life she's going to inject it. I mean, she's fearless. Great courage and great technique. So I love working with her because sometimes I'll call her and say, hey, what do you think about this? She goes, go for it. and it's been fantastic. So one of the things, going back to the people that have had problems with meshes, these are very difficult people to deal with. It's difficult women. They're usually a little bit elderly. Their tissues in the vagina are very thin, which is one of the reasons why we get the erosions. You try the usual things with hormone creams. Some of them will close, but a lot of them don't. Surgically, we try to remove them, which is a nightmare after all those years of being there. And so I started getting courageous and saying, well, I don't know what else to do for these people. So I started injecting all these vaginal erosions that wouldn't heal with PRP. And to my surprise, 9 out of 10 of these women, all of a sudden the tissue would regenerate, the mesh would go away, and fortunately the thickening of the vagina would, the tissues were great. So it was godsend. And slowly from that I started using it in other areas of my practice. And then about 2012, I started using it out of desperation on my women with chronic pain. I mean, I was the first woman urologist in Colorado, and I would inherit every poor woman who had pelvic pain as far as, related to the bladder, related to intercourse. And for the longest times, we all know as physicians, they're very difficult people to take care of because we haven't had the right tools to help them with. So PRP has added in my practice an incredible tool to help a lot of these poor women who don't have a life, who either go to the bathroom every half hour or an hour during the day and night, whose pain is so significant they're not able to be intimate in their relationships at home and with their partners. So it has been incredibly effective in women that had failed everything. We've been trying to work together as a team about modifying our techniques and trying to improve outcomes, but I can honestly tell you that it's been significant. The results are amazing. We have, we're kind of taking it to the next level and say, working with women and men who have normal function or have minimal problems is great. And now we're trying to take this as a team saying, okay, what other areas can we take this into that are difficult, that are having major life impacts on individuals? And you've heard from Dr. Banno a lot of what he's doing with erectile dysfunction. For me, being a urological oncologist and prostate cancer being the love of my life, I know that sounds kind of weird, but I've been doing research since 1988 on this. It's been awesome to see how I could apply a technique like PRP and not just help men prevent future problems with erectile dysfunction, but also recover some of the guys that have already gone into erectile dysfunction from treatments such as radiation or radical prostatectomies. And how do we use the PRP and techniques that we're putting together in helping them go back to having a good life? And so this is one research project that we're putting together, and I'm hoping it will get funded and we can then provide, a good sexual life for these people that have been penalized enough for getting cancer and now are finally over the cancer. Now we need to help them live again. What the things that have worked in my practice, of course, like Dr. Roy and Dr. Banno were saying, is making my own staff be a part of it, making them, understand it, not just kind of go through the process, but if they really see the results like they were saying, they buy into it. We don't try to sell it. We don't need to sell this because we are just honest. And we just tell, wow, look, this is what we've seen. This is, and when you speak it through the truth and people see through you and they go, yeah, this is true, this is working. So I think the best salespeople in my staff are my nurses and my MAs, and none of them have a marketing degree, I can tell you that. Bonuses always help. I always feel like if we're going to benefit, why not have our staff benefit as well? So having bonuses or a bonus structure is helpful. It makes them feel appreciated. We use a lot of other techniques. We try to engage people in our community. we establish, we try to educate our other physicians around us. Not everybody is ready to do PRP, but other physicians can appreciate it. They're just not wanting to do it themselves. So just letting our community of physicians around us know what we're doing is very helpful. We love to have webinars like we're doing today, and it's good to realize that we can do that with patients as well. So don't minimize that. People nowadays may not want to leave, primarily like today. We had ice and snow in Colorado, so people appreciated the webinar rather than coming into the office for visits. Having Yelp, and whether we like it or not, we're moving into an era of computerized, even for elderly people like us, and I'm just joking about that, but we have to come to the times. So, accessing Yelp and Google reviews and anything else like that is significant, and I would encourage you to not forget those medias. And just ask your children or ask people that are younger, and they will tell you the power of that. I can tell you that when my children went to Europe, to Italy, on vacation, they found the best restaurants ever, and they found it through Yelp. So there's no reason why we cannot do the same as far as letting people know what we're up to. And then remember that, I'll be honest with you, I love dealing with urological issues and cancer and PRP with chronic pelvic pain and joint injections. But the truth is that I don't have the time. I'm busy, and some aesthetics, sometimes I don't have as much time to do that. But remember, there are people in your office that can help you. You can train. And Dr. Banno was saying that he has a PA that he's been able to encourage and teach, and that she's very significant in his practice in doing the aesthetic portion. In my practice, we do the same thing. So you don't have to learn it all. You don't have to be the only one doing it. Just know that you can engage other people in your practice to participate with you.
Excellent. Thank you, Dr. Ripoll and Dr. Banno. That was awesome. Just not going to keep you too much longer. Wanted to run through a couple of big questions that are always asked, and that's, what's the profitability? So we just put together a little chart here. Everybody's a little bit different. This is what I charge in my practice. So for the O-shot, $16.50, I include the apex or the intensity and the priapus. You can see so on and so forth. It can be really quite a revenue generator. This particular slide shows you the cost of goods. So if we'll take the O-shot. If I'm charging the patient $16.50, I'm purchasing the PRP kit. I'm also purchasing the apex or the intensity. So my gross profit is $1,200, and that is not bad at all. I don't know about you, but I have to work pretty hard for $1,200, and to do an O-shot and to do the consultation with a woman and feel like I really have something to help her is not only rewarding from a spiritual perspective and a professional perspective, but also from a gross profit perspective. It takes minutes really to do the injection. It takes less than 10 minutes to actually create the platelet-rich plasma. My staff participates, so my part of that time is really pretty short. So the return on investment here is significant. I mean, really, you need to do 4 procedures, 5 procedures to completely recover your cost, and then you're going on to add to your bottom line, which is very important as physicians. I mean, we have businesses that we're running, and so there's no shame in taking people's money for procedures and that actually work, right? That's a beautiful thing. So again, this graph showing 5 procedures a week or 20 procedures a month, which would equal 240 procedures annually. And if we just use my numbers as an example, you're actually putting $315,000 of profit on your books, which is really very nice. The equipment that we use is, again, follows the science. Absolutely important to understand the basic science so that we can predict best outcomes. I mean, if you need to create an angiogenesis, then you better have enough PRP, or platelets rather, concentration to do that. And the science tells us what the sweet spot is for these particular regenerative processes and what it is that we need to do. So we can certainly talk to you more about the equipment that we use. When you purchase the centrifuge that we're using with 10 of these kits, you're looking at $5,500. I mean, it's kind of a no-brainer. 4 procedures, 5 procedures, you've paid for your equipment completely. So this is not a expensive adventure by all means. You know, medicine is changing. We need to change with it. People are seeking these types of procedures. These techniques are very safe, as we've said this before. PRP and doing these procedures, whether you're using your own names or some of the popular trademark names, is very significant on the internet, which is where we get most of our patients. So it's a great marketing tool as well. And again, you know, StudioPRP, Dr. Banno, Dr. Ripoll, Jill and I are here to partner with you and to help you grow your practice. Dr. Ripoll did not mention that she trains physicians. She's been training physicians since 2013. She does an amazing job. I've been at her training in the past, and I'm very impressed with what it is that she offers with the HOPE protocol and her own personal, very rich experience. Dr. Banno's been training physicians as well since 2015. He incorporates testosterone therapy into his training. He will show you around the OR and teach you to do penile implants. So you've got lots of different resources here to help you to introduce PRP and to be successful with Play the Rich Plasma. There are training centers, again, in Colorado and Illinois. We as a group do private trainings. Personally, I think that's the best. You know, if you could have Dr. Banno or Dr. Ripoll travel to your office where your equipment is in place, all your supplies are in place, you know, Jill and the team help you get all that stuff in place ahead of time, then they're training you on your patients in your office and training your staff at the same time to support you with these procedures. So that's a great way of getting your training. And if you email info@studioprp.com or if you call the number listed 561-299-0603, you can certainly get more information about how to get your equipment and if you need training and where to best get that. So thank you. We kept you longer than 30 minutes. I do apologize. Hopefully it was helpful. Anyone have any questions? Okay, so when's the next training? The next training is in Colorado on March 17th and 18th. And actually, Dr. Ripoll and I will both be there. And I'm not sure about Dr. Banno. He also has trainings on a regular basis every month. So again, call or email and we'll be happy to give you more information. Chris, thanks a lot. We really appreciate you hosting the webinar.
Thank you, Chris.
Yes, thank you, Chris, very much.
I think Chris is muted. All right, good night, everybody. Unless you have anything else to add, Dr. Banno or Dr. Ripoll, you think we covered it?
No, I think you did not.
We're good. Okay, thank you. Bye-bye, guys.
Good night.
Sorry, I had mine on mute there. Thank you very much.
Bye, Chris.